So good morning, I'm Dr. Sindhuja from the Department of Conservative Dentistry and Endodontics, and today my topic of discussion will be on complex amalgam restorations. Okay, so coming to complex amalgam restorations, we are going to deal under these contents of introduction, definition, its indications, contraindications, advantages, disadvantages, and the different types of complex amalgam restorations, and how the cavity preparation have to be done for a complex amalgam restorations, and also the complications that are usually come across during the process of this preparation, what are its effects on the pulp, and how do you do a pin removal, and also the additional aesthetic features of a complex amalgam restorations. So coming to the introduction, obviously as we know that amalgam is such a material that doesn't have any chemical adherence to the tooth structure. We prepare the cavity in such a way that it has few resistance and retention form features, so that cavity preparation helps in the retention or the resistance for a amalgam restoration. But not just for this amalgam can be not just be used for a normal small type of cavities like class 1, class 2 or something. What about the situations where the tooth is grossly decayed but not involving the pulp? In such cases, obviously the resistance and retention form features that we give for a restoration, it cannot be similar to that like how we give it for an ideal teeth. So in such cases, obviously you have to give some additional retentive and restorative features in order to make the tooth retain the restoration. Those are called, these additional retentive features whichever we give are the pin retain restorations. Okay. So usually these are used to replace the missing tooth structure of a teeth that have been fractured or severely involved with caries or any existing restorative materials. Okay. So what is this simple restoration, compound and a complex restoration? So usually a simple restoration is the one which only involves a single surface of the tooth, right? Compound restoration can be either two surfaces of the teeth, like either our class 2 cavity like a mesio-occlusal or a disto-occlusal. Coming to a complex restorations, which is the topic for today to be dealt. Here the restoration involves more than three or more than three surfaces of a tooth, okay, like MOD type of cavities. So coming to the major definition, this is actually a very important definition. So coming to the pin retained amalgam restorations, it is a restoration that requires the placement of one or more pins into the dentine to provide adequate resistance or retention forms. Okay, so in pin retained restorations, there is something called slot retained type of restorations also. This slot is nothing but a retentive groove that we place into the dentine, which is usually placed, it is given in a horizontal plane. Okay, these slots can be used in conjunction with the complex amalgam restoration or can be given as a separate entity. So what are the major indications? Now that we know what is a definition of a complex amalgam restoration, we'll see in which cases usually we can indicate this complex amalgam restoration. Like a broadly broken down teeth, or in a teeth with questionable prognosis wherein the teeth can go into a root canal treatment. In such that borderline cases can also be treated, and also as an auxiliary or a reciprocal retention mode for preparing containing principal retentive modes which are insufficient to prevent the restoration displacement. Like already the teeth has a retentive feature, but that could be insufficient. So as an auxiliary mode of retention also a complex amalgam restoration is given. Okay. Apart from that, as a foundation under a fixed processes, or in case of economical cases where the patient cannot afford a root canal or an extraction followed by implant, in such cases this can be done, and also in case of considering the age and health of a patient. Coming to the contraindications, the absolute contraindication for using a complex amalgam restoration is in a case where the patient has occlusal problems, where there are high masticatory forces and all. In such cases, it is a big no-no to give a complex amalgam restoration. Apart from that, because it is obviously composites, because it's obviously amalgam restoration, the aesthetic concerns in case of anterior teeth, it cannot be used. Okay, in cases of access difficulties, especially in case of class 5 restorations, in such cases what happens is the accessibility to place the pin inside the dentine is reduced. So in order to prevent that, usually you don't give complex amalgam restoration in such cases. And also one of the major thing, like in case of young individuals where there are very high pulp chambers and the pulp horns are very high, in such cases cases, obviously placement of a pin inside the dentine can lead to pulp exposure. In order to avoid that, obviously it is a contraindication in such cases. Okay. So what are the major advantages of this using this complex amalgam restorations? Usually to an extent it conserves the tooth structure. The major thing is the appointment time is actually reduced as compared to cast restorations, and the retention and the resistance forms of the pins and the slots can be increased very significantly. And economic factors also, compared to the implants and all, it is a much economical option. Coming to the disadvantages, obviously because the dentine, there are pins that are being placed into the dentine, the chances of dentinal microfractures are higher. And apart from that, the fracture resistance of a teeth can be lowered, and the strength of amalgam restoration can be reduced because of the tensile and the horizontal strength, and also because of the placement, or especially in case of cemented pins, there can be dissolution of the cement around the pin leading to micro leakage. And apart from that, obviously as discussed, there can be penetration, perforation of the pin into the pulp chamber or into the periodontal ligament, and also the difficulty to achieve proper contacts and contours can be minimized when in comparison to a prosthesis. Okay. So that there are different types of complex amalgam restorations. The first thing is the pin retained amalgam restorations, slot retained amalgam restorations, foundation restorations, amalgam pins, and bonded amalgam restorations. In this topic, we will discuss in detail about the pin retained amalgam type of restorations. So what is a pin retained amalgam restoration? Any restoration requiring placement of one or more pins inside the dentine in order to provide adequate resistance and retention forms. The major thing that has to be put in mind is that placement of pins does not increase the strength of the teeth, nor does it increase the strength of the restorative material. It only improves the resistance and retention form of a cavity preparation. Okay. So slots, locks and undercuts can't provide the resistance and retention forms. Greater retention, usually these pins provide much better retention than box only type of preparations, or in case of any bonded amalgam, in case of bonded amalgam restorations like composites. So coming to the broader classification, they are basically classified under direct or non-parallel pins, indirect or parallel pins. Okay, in direct or non-parallel pins, you have something called cemented pins, friction lock and threaded pins. In indirect, you have cast gold type of pins and wrought precious metal alloys. Okay. So let's talk about the cemented pins. Usually the cemented there is something has to be discussed before getting into the pins. The pin when you see in a broader aspect, you have something called pin and the pin channel. Pin channel is the one that is being drilled into the dentine. That is a pin channel, and there is something called the pin. The three different types of pins differ in their diameter of the pins and the pin channels. Okay, so cemented pins, coming to it, it was first introduced by Markley in 1958. So coming to the pins, the diameter of the pins are usually smaller than that of the pin channels. Because it is a cemented pin, you need to have additional space for the cement also to occupy in the pin channel. The diameter of the pins are like 0.001 to 0.002 inches smaller than that of the pin channel. Okay, coming to the pin size is about 0.018 to 0.030 inches. Okay, so coming to the retention of this type of pins, it is with the help of any luting cement like zinc phosphate. Okay, so coming to the indications of this, it is indicated in cases where there are least amount of stresses that are desired. In such cases, usually you can go ahead with the cemented pins. Okay, coming to the disadvantages, obviously it has the ease of placement because it is being cemented and it is passively fitted inside the dentine. The amount of internal stresses are less. Okay, and because it is being luted with a standard luting agent, the amount of stresses that can be dissipated all along the dentine is minimized. Okay, coming to the disadvantages, obviously it has a reciprocal interaction. Less the amount of internal stresses, so less will be the retention also for this type of pins. So coming to the next type of pins, they are the friction lock pins. Okay, these friction lock pins were first given by Goldstein in 1966. According to this, the pins have a diameter 0.001 inch larger than that of the pin channel. Okay, And the mode of retention in this type of friction lock pins is that it uses the resiliency of the dentine. Okay, it has to be just fitted inside the dentine, and it is the resiliency that provides the resistance and the retention form to the pin. Okay, it is actually has a better type of retention, like for about 2 to 3 times higher retention than that of a cemented pin. Coming to the indications, it is used in vital teeth with good access and ease of tapping, and ease of tapping and locking the pin. So what happens is, because it is a vital teeth, the resiliency of dentine is also quite sufficient for it to maintain its resistance and retention. Okay, coming to the advantages, as discussed, it is 2 to 3 times more resistant. It has more retentive features than that of a cemented pin. Coming to the disadvantages, it has increased internal stresses. It has to be tapped inside the dentine with the help of a mallet, and also the placement of pin is difficult. The accessibility is a question over here. So coming to the threaded pins, it is introduced by Going in 1966. This is the usually most commonly used type of pin in the present scenario. Okay, in this the pins are about 0.0015 to 0.002 inches larger than that of the pin channel. Here also it uses the resiliency of the dentine only to provide the resistance and the retention form. Okay, of all the types of pins, this is the most retentive type of pin. Okay, coming to the depth of the pinhole, if you see in the previous types of pins, if you see the depth of the pinhole, it is about 3 mm. Coming to the friction lock also, it is about 3 mm. But coming to the threaded pins, the depth of the pinhole is only 2 mm. So obviously the chance of perforation into the pulp chamber or the chance of any symptoms that the patient develops, it is less in case of this threaded pins. In threaded pins, the most popular thing is the thread-made system that is commercially available. So indications in a vital teeth and advantages, it is placed with the help of a hand wrench and a contra-angle handpiece. I'll show you the picture in the later slides. And pin placement is also easy because there is a hand wrench that is used that can be used to place the pin inside. It is actually the most retentive of all, about 5 to 6 times more retentive than the friction lock pins. Coming to the disadvantages, obviously more the retention, there can be less chances, there can be more chances of the development of internal stresses. So the thread-made system, the reasons for using this is, it is more versatile. There are wide varieties of pin ranges in different colors and sizes available, and it is easy to identify the pin because of its color coding system, greater retentiveness, and because of the gold plating on the surface, it eliminates the probability of the tooth getting corroded. So these are the different types of pins available: regular, minim, minicum and minuta. So in regular, if you see the dimensions of it, of all, the regular has the largest dimension. Coming to the minim, which is about 0.024 inch. Coming to the minicum, it is 0.019, and minuta, which is the smallest of all. But the most commonly used pins are this minim and minicum. Okay, and even these are even color coded, like already told. Regular has a gold color, minim has a silver color, minicum has a red color, and a minuta has a pink color coding. Okay. So if you have a comparison of all, obviously regular has a largest diameter compared to the others. More the diameter, more is the amount of internal stresses that are created, and more amount of dentin crazing is also seen. It is rarely used. Coming to the next, the amount of dentinal stresses and dentin crazing is comparatively reduced. So minim and minicum are usually used because of its good amount of retention and reduced amount of internal stresses. Coming to minuta, it doesn't, because of its least amount of diameter, it is less retentive. Okay. So coming to the pin design, there are different types of pin designs. Okay, it has a standard design, shelf sharing, 2-in-1, link series design and link plus design. Coming to a standard design, it has a 7 mm length. It has a 7 mm long design of pin. It has a flattened head which fits into the hand wrench or a chuck. After placement of the pin, you have to just turn it counterclockwise for about one fourth of its rotation in order to reduce the amount of stresses. Coming to the shelf sharing type of pins, obviously as the name indicates, the pin head gets sheared off after attaining a certain depth inside the dentine. They have flattened heads that fits into the hand wrench or a handpiece chuck. So after the pin reaches the bottom of the pinhole, it obviously gets sheared off. Coming to the 2-in-1, it is similar to that of shelf sharing only, but it has two different types of pins of about 4 mm each, which is connected with the help of a joint in between. So the total length of the pin is about 9 mm. So you need not reload the handpiece with the chuck for the second pin to place it in. Once the first pin is being sheared off, automatically the second pin can also be used. So coming to the Link series design, they have a plastic sleeve. This is the plastic sleeve that fits into the latch type of contra-angle handpiece or with the help of a special plastic hand wrench, and the pin engages into the dentine, and the plastic sleeve, whatever is there, this can be discarded. Okay. Coming to the Link Plus design, it is similar to that of Link series, but just the difference is that it is available in single or 2-in-1 pins, and the diameter and the taper is little reduced compared to the Link series. So these are the different hand wrenches that are available, and these are the handpiece chucks for the respective pins. So what are the factors that affect the retention of the pins in the dentine and amalgam is the type of pin, that is the self-threading pin is most retentive compared to the cemented pins, and the surface characteristics, the number and the depth of elevations in the pins. More is the number and the depth, more will be the retention, but the amount of internal stresses are also comparatively more. And coming to the orientation, number and diameter, more retention is there with the non-parallel pins, and bending of the pin is usually not desirable because either it interferes with the condensation of amalgam or there is a chance of breakage or fracture in the dentine. So obviously as the number and the diameter of the pin increases, the depth of endangering the pulp and perforating it is more. So for a self-sharing, self-threading type of pin, retention is not increased when the depth of the pin is increased 2 mm into the dentine, and pin extension into the dentine and amalgam greater than 2 mm is unnecessary for pin retention, and it is contraindicated to preserve the strength of dentine and amalgam both. So in pin placement, you have something called mechanical aspects, anatomical aspects, and the mechano-anatomical aspects. So coming to the mechanical aspects, you have in relation to the pin and the tooth structure, that is the stressing capabilities of pin, retention of the pin, and micro cracking and creasing. And coming to the pin and the restorative material related, it's in relation to the strength or the retention of the amalgam. So what are the different techniques that you use to insert the pin is first the preparation of the pin channel, cemented pin technique, threaded pin technique, and friction grip technique. So for the preparation of pin channel, you have something called a twist drill, burrs, and measuring probes and depth gauge in order to determine the length of the pin channel. Okay, twist drill, by using a twist drill, latch type or a depth limiting drill at a low speed of about 300 to 500, you have to, that is a low speed handpiece. With the help of that, you have to drill into the dentine. Using a 1/4 round burr, first you have to make a pilot hole so that we are sure that we are exactly in the area which is necessary in order to prevent perforation into the pulp or the periodontal ligament. So after that, you have to apply intermittent pressure, and after making a pilot hole with a round burr to localize the position of the pin, complete the hole in 1 or 2 thrust movements. Okay. So usually it is a ultra low speed type of machine. So it's used to prepare the pin channel. So this is the tip, this is the amount of length that it has to go inside. So after the pilot hole preparation is done with the help of twist drill, you prepare the pin channel. Okay, this is the initial pin hole that you prepare with the help of a round burr followed by the twist drills. So bending and shortening on pin trimming. Usually whatever the pin that is to be placed, it has to be 2 mm above the dentine, like 2 mm below the into the pulp chamber and 2 mm above the dentine. So anything excess has to be removed because it interferes with the condensation of amalgam also. So shortening using a TMS bending pin, this is a TMS bending tool which can be used to drill the pin. So coming to the cavity preparation, obviously as how we do other cavity preparations, you just have to remove the caries in the weakened tooth structure. After the initial type of tooth preparation is done, we should make sure that the facial and the lingual walls are kept parallel to each other and the margins should be placed supragingivally. The areas, this is very important, the areas that has to receive a pin has to be flat and perpendicular to the long axis of the teeth. There must be enough amount of dentine in the area wherever you are placing the pin, and weakened cusp should be reduced and the occlusal contour should follow the normal contour of the unreduced tooth. It is important to think about the pulp protection also. So what in the case of a pulp pin removal, usually you can use a artery forceps to remove a pin, or with the help of a tube with cyanoacrylate. Burr in anti-clockwise direction can be used, and also with the help of ultrasonics. So the complications of pin placement, what can happen, what are all the anticipated complications that has to be kept in mind whenever we use a pin. Usually the twist drill, whatever we use, there is a chance of breakage of the twist drill or the breakage of the pin, because we usually use a resiliency, so we tighten it with the help of a mallet. So in such cases there is a chance of breakage of pins, loose pins, twist drill dulling. Because of that, you have to put more amount of pressure in order to drill. Dentinal cracks, heat generation, there can be perforation into the pulp space, or there can be perforation into the external environment. So these are the radiographic pictures which have shown the perforation into the external environment, into the alveolar bone, into the periodontal space. So what are all the failures that can be anticipated here? It is a fracture of the restorative material. Either the fracture can occur in the restorative material, or there can be separation of pin from the restorative material, or there can be fracture of the pin, or there can be fracture of the pin inside the dentine, or there can be dentinal fracture. So usually what is the effect of pin on the dental pulp is, usually it responds positively and accepts its presence without any adverse effects, because we make sure that there is enough amount of remaining dentine that is present so that the pulp is protected properly. So histological evaluation reveals inflammatory response, necrotic tissue encapsulation and fibrous tissue degeneration and formation of predentine biodontoblasts, and inflammatory reactions can also be observed under all types of pins, but these doesn't affect the these are in a histological level, so this usually doesn't affect if pulp is being properly protected. So additional retentive features of amalgam restorations are we can give retention locks, grooves and coves, groove extensions, skirts, beveled enamel margins, pins, slots, amalgam pins, or placement of etchant primer or adhesive, or enamel wall etching can be done, or in case of dentinal treatment can also be done. So these are the retention locks, like in the form of grooves which are placed vertically inside the cavity preparation. These are the vertical grooves that are placed in the proximal box areas. So these are the coves that are additionally given. These are appropriately placed undercuts for incisal retention of class 3 restorations and occlusal portions of class 5. If you see in this picture, these are the coves. And the other additional features like groove extensions can also be given, like a facial groove or a lingual groove, in order to prevent the retention, in order to increase the retention of a tooth. These are the skirt type of preparation, which can be given in a cast gold type of restorations, usually given along some line angle of a tooth. And beveled enamel margins, obviously to improve the retention. It is majorly given in a cast restoration to improve the metal margin relationship. Okay. And these are slots usually given in a class 5 amalgam restoration of about 2 to 3 mm deep. Internal cavity wall within a floor of the preparation, having a continuous surrounding wall and a floor. So these are amalgam pins shown in this picture. So given by Shavel in 1918. These are usually vertical posts of amalgam which are anchored into the dentine. Okay, it has about 1 to 2 mm deep and 0.5 to 2 mm wide and about 0.5 mm inside the dentine. So these are the various retentive various retentive and resistance features that can be given. So all the process of doing this is to save the vitality of the pulp so that the tooth can be made live longer in order to prevent that the teeth can be postponed for a root canal treatment, and also because of the economic concerns whatever is concerned with the patients. So usually the prognosis of such teeth is good provided you give a proper pulp protection and all. Okay, usually in case of a badly broken teeth, pins are also one of the treatment option. Okay, in cases where the patient is not willing for a root canal or something like that. Yeah, thank you.